Hey everyone, welcome back to the stream. Today we're going to be answering questions about the medical coding industry, careers, exams, schools, CEUs, jobs, studying, and more. Grab yourself a drink, say hi to your friends in the chat, and let's get started with today's live stream. Hey everyone, I'm Victoria. I'm a medical coder, auditor, educator, and content creator. And on my channel, I provide tips, tricks, and tutorials to help you be successful in a medical coding career. And just about every Saturday at 2 p.m., I am here to do question and answer, AMA. Ask me anything about the medical coding industry. And I have an exciting idea. And let me know what you guys think in the chat. But I had the idea, sometimes I get questions about denials, which I'm not super strong at, but sometimes can piece some things together, or just coding cases or scenarios, specific questions about, hey, can I use a modifier on this? Hey, well, how would you code this scenario? I think for next week, what I'm going to do is put together a place where you can drop questions. Because I also have people that want to ask questions, but they kind of don't want to ask them live and have their name attached to it. So I thought it might be cool to have the live stream have a question and answer submission so that you can have, if you have a specific case that you want to kind of put the case scenario in, or you have a question that you don't want live, that I can put it into the form, and then I can read it, and you can kind of still stay anonymous. And if you have specific coding questions or case studies, we can go over those as well. So I'll have time to research them before I go live, because sometimes when it's a specific coding question, I don't have the time to dive into CPT Assist or Coding Corner while we're going live. So hello to all of you coming in here. Megan M, great to see you here. J Bombs, awesome. Leslie Daniels, hey Amanda White, hello. Good to have you all here today. I am excited. It is a great Saturday. It's starting to see the fall weather coming in here in Pennsylvania. So excited about that. Very, very great stuff. So let's start out. I have some questions that came through with Instagram that I will go through if I have time, but let's take some questions from the chat today. Is anatomy and physiology essential? So I think you could probably get away without taking anatomy and physiology to be a biller or a coder. Would it be better to take those courses? Absolutely. The more knowledge you have, the faster you can code, the faster you can understand things, the more proficient you'll be at your job, the better you can communicate with other healthcare professionals. Medical terminology, I would say 100% is a must. Anatomy and physiology, I would highly, highly recommend, but I think you could probably get away without knowing anatomy and physiology. I mean, if we're talking to just about passing the exam, so say your goal is, I want to pass a medical coding certification exam. If we look at what's on, for example, the CPC exam, which is probably the most popular and widely demanded medical coding credential. If we look, let me quick log out of my account here. So if we look over on the AAPC website for the CPC certification, what it tells you here at the very bottom is the exam breakdown. And there's not a huge amount of it that's specifically questions on anatomy, 8 questions. So there is going to be a little bit on there. Some of it, though, you can piece together if you already know where some of the things are in your book. So your structure of the heart, your different diagrams, sometimes you can piece those 8 questions together. Of course, better if you take an A&P, but not necessarily required. You could probably make do without it. Medical terminology, I would say absolutely 100% a must. Now, that doesn't mean you have to take maybe necessarily a full college course on it. If you can find something comparable, that will work as well. Maybe you can find, I recommend on one of my midterm videos that I have that there's Crash Course A&P, that it's basically an entire course on anatomy and physiology that you can watch for free on YouTube. So if you're a good self-study person, you like videos and stuff, that would be an excellent opportunity to take advantage of. Hey, Kristen Cruz, thank you so much for becoming a new member to the YouTube channel. By the way, if you are interested, we do have channel membership available. So there are 3 tiers of channel membership for Contempo Coding. There is the silver, gold, and platinum level from $1.99 to $9.99 a month. And what that does is you get access to community-only posts. You get access at the gold and platinum membership levels to have your name added to the end credits. Platinum, you get behind-the-scenes footage and outtakes. And at all membership levels, you also get custom emojis, and there is one other perk: custom emojis and community-only posts. So yeah, there is a great resource that I have on my channel about talking about medical terminology and anatomy and what those resources that I recommend for those are. From where to start coding, I would go into Google and I would type medical coding classes near me and see if you can find a local instructor in your area, or try and find a boot camp. It kind of depends on where you're starting out at. If you're someone who has no healthcare experience whatsoever, you're going to need more in-depth training than someone who already knows medical terminology, who already knows a little bit of anatomy, who's had some exposure to probably to insurances. So, depending on if you're brand new, you're probably looking at several months at least of training to become a medical coder. How do you become a member? So there should be a button at the very bottom right-hand corner of the video that says join. I think it's there as well in mobile. I'm not 100% sure. I know everyone's phones work differently. So some of the things that show on my mobile and show on my desktop look a little bit different than some of the other viewers of my YouTube channel. And also depending on your YouTube settings. I had someone message me once and they're like, can you please turn off the closed captioning on all of your videos? It's very annoying. And that's not a setting that I set. That's actually a setting within your YouTube, not something that I have. But I do subtitle all of my videos, or at least I set YouTube to subtitle all of my videos. What it does is it should automatically close caption or subtitle them, but every now and then there's a video that YouTube just seems to kind of struggle with. Maybe there's an issue with the audio or something and it doesn't automatically do that, but they should all be closed captioned or subtitled. Let's see here. I wonder why my alerts aren't showing up. That's so funny. But thank you, Yvette, for joining channel membership. I really, really appreciate that. Welcome to the Contempo Code community. Here's a question from Mary Ellen. This is a great one. So what information is allowed to be written in our books for the CRC exam? Definitions from the study guide. You have your exam Saturday. Oh my gosh, that's coming up soon. So there's actually information on this on the AAPC website. They may have sent you something, so I would check your AAPC notifications about your exam if they sent you any information regarding the exam, because sometimes they will include the proctor examinee instructions, which are included in there as well. So what I always do is I go into Google, and if you type AAPC exam FAQs, that's how I find it the easiest. So let's look over here. And here's all the certification exam FAQs. So in here, it says what's allowed in our books. It's a little tiny, so I'll read it off. It says, and this is for all AAPC exams, not specific to the CPC or any exams. This is any certification with the AAPC. Handwritten notes are acceptable in the coding books only if they pertain to daily coding activities. Questions from the study guides, practice exams, or the exam itself are prohibited. Tabs may be inserted, taped, pasted, glued, or stapled in the manuals as long as the obvious intent of that tab is to earmark a page with words or numbers, not to supplement information in the book. Altering, whiting out, painting, or printing over any pages within the code books, such as the marketing pages, table of contents, references, etc., to supplement information is prohibited. No materials other than tabs may be inserted, taped, pasted, glued, or stapled in the manuals. So if you have definitions, if you have abbreviations that you can't remember, you can write those in your exam. So definitions that you have problems with, abbreviations, if you have specific concepts that you want to write yourself a note with, if you want to write notes to see certain pages, those are all acceptable. Just you can't take your questions from the study guide and then put those questions into your exam. With the CRC exam, I will also mention that I get a lot of questions about, the tables, like the Trump lists and the HCC listing. For the specific CRC exam, if they're asking you a question about, the hierarchies or the HCCs, and they want you to look at a table, they will have that specific chunk of the table that you need to reference within your exam booklet. So you don't have to write any of those HCC tables or any of the hierarchy lists within your code books. Amanda White. So I do have a couple of different references for you. So I have a playlist first off on my YouTube channel. It's a little bit more basic. I feel like one of these days I should really do an E&M where it's like the longest E&M explanation ever, where I really talk about like what is not even just like the review of systems, but like integumentary and what's that mean. It would probably take me like 10 hours just of video. But let's see here on the channel. Where is it? Okay. So on the channel, I do have an evaluation and management coding playlist, if you would find that helpful. The other thing I recommend is E&M University is usually good. They have lots of great information. Just go into Google and type in E&M University. The other one is a lot of the Medicare contractors have education sessions that you can get for free. I know the AMA has had some as well, but I like the stuff from my Medicare contractors. So mine is Novitas. Let's see if I can find something real quick to kind of bring it up. So Novitas Solutions. And sometimes these websites can be a little tricky to navigate if you're not familiar with them. So here's mine. And under Novitas, they have education and training. So here's some of their on-demand training. And a lot of times, pretty much always, they have something coming up for evaluation and management. So here they have online training courses. You have to have an account set up for some of those. And let's see, Novitas offers free education to all participants. Let's see what this brings up for their learning center. But yeah, oh, here it is. Their upcoming events, online and self-paced training courses for Part A and Part B. Appeals, chiropractic services. Here we go. Evaluation and Management 101 and 102. Here's what, Incident 2 services coming up. And if you already have a certification with the AAPC, they do offer CEUs for the stuff that they have through these Medicare contractors. So this is the one that I have in my area, Novitas. But depending on where you are in the United States, you may have a different Medicare contractor. Oh, let's see what else. But yeah. Oop. You are welcome, Amanda. Absolutely. Let's see here. Dawn is asking, I don't know if I should take a full course or a review for the CPC exam. I've taken the exam but didn't pass. So let's talk first about what training have you been through and how close were you to passing? Because if you were at like a 65 to a 69% on the exam, you were super, super close, which means you just need some fine tuning. So maybe you just need a review. Maybe you need something like that's on my website. So I have a bunch of different courses available. I actually have my boot camp coming up the first weekend in October for the CRC, if anyone's interested. But I have like a CPC review and practice examination. So if you were pretty close to passing the exam, that might be a good option for you. And it would be right here. So the CRC review and practice examination, that's $29.99 on the website. Lindsay West is saying that she is having trouble seeing me. Is anyone else having issues with my camera and my connection right now? Let me just check one thing, see what internet I'm connected to. Okay, it's disconnected. Okay. Yeah, maybe my connection's just a little funny. Every now and then this tiny little icon pops up for me. So I'm thinking maybe my internet is just having some connection issues. So I apologize if it is coming up pixelated. Let's see if I can do anything here on the back end. Stream output mode, bitrate 2500, audio bitrate 6160. Video, yeah, it says that the output's coming at 1920 1080, so I don't know what the heck's going on. Maybe it's got to just be my internet connection. I apologize for that. So let's see yeah, it's got to be touchy internet. So let me see, where was I? Oh, so maybe it's just a review that you need. If you're pretty far off, there are other options. So let's say you are under a 50%. So you're getting less than 50% on the CPC exam. That means you probably need something more robust. So at that point, maybe you could go back through some of the study materials you had through your school or through your prep course and refresh on them. Maybe start from back to basics and go from there, or look at the areas where you did really poorly on the exam, because you can get your exam results target areas. So if you took the exam in person, you'll have access to those through your My AAPC account. If you took the exam online, you have to call and request them, but they can tell you, hey, you didn't score well in radiology, you didn't do so well in midterm, and you can kind of target those areas. So you could re-review through some of the materials that you already have. And there are some places that offer something in between a review and a full course. So I think Integrity Coding sometimes has some, and I know CCO has what they call their Blitz programs, which are more than a review, but not as much as a full course. So that could be something else to look into. I'm glad the video is looking better now. Awesome, awesome. So am I coming up with a CPMA? I know I saw a question coming in here. Do I have any boot camps coming up soon for the CPMA? So I need some feedback here, because here's what I'm thinking. I can do a boot camp for the CPMA. I'm just not 100% sure, first off, what the interest in it is. And second, what sort of length of boot camp would be a good option. Because I think my CPMA, I could probably do around the same time as my CRC, meaning it would be like between 6 and 8 hours for the boot camp, assuming that you already know medical terminology, medical coding, and you're just focusing in on what are the concepts I need to know for the CPMA, and then me giving you the tools and guiding you through that. But the thought process is I could either do that as a weekend, like I do the CRC, kind of break it up Saturday, Sunday, or I'm also considering for either the CRC or the CPMA, doing a night school where maybe we do a Monday, Wednesday, Friday, and we do, 2.5 hours each day. And that kind of breaks it down a little bit more throughout the week. But yeah, kind of need some feedback on that. Like if anyone would be interested in doing, instead of a weekend, doing like a Monday, Wednesday, Friday night school 1 week. Lindsay West is asking, do you have any videos about coding specialties such as emergency, cardiology, OBGYN, etc.? I'm wanting to learn more about it and see what I might want to specialize in someday. I do have, so the closest thing I would have on the channel would be my CPC review for each section. So I have one for cardiology, one for respiratory. They aren't really so much targeted towards the specialty so much as the chapter of the CPC curriculum. The other thing you could consider is they do have some specialty training with the AAPC that you could maybe look into and see if you like those type of coding cases. So if we go onto the AAPC website, I know they do have some stuff in here about, let's see, education and training, auditing, medical coding, advanced courses. Let's see here. View all courses. I know they have some specialty practicodes, and I think sometimes you can find some specialty courses on here as well. Let's see what we've got. Medical, educational partnerships, medical coding, online classroom. Ooh, advanced specialty courses right there. I almost missed them. So we have some for neurology and neurosurgery, behavioral, denial, dental billing, EMRs, E&M online training. So you could take potentially some of their specialty courses, or they also have the practicode in specialty as well if you want to see what it's like to kind of code for a certain specialty. Let's see, where are they? Practicode, and then experienced coders. So you can get specialty bundles to practice coding for these specific specialties. Do I have a review for OBGYN? It's a very small targeted one. That would be review for like the CPC, but not for like the specialty credential for OBGYN. Hi, Victoria. How do I find out who I contract with in North Carolina? I'm not sure if you're maybe referring to like the Medicare contractors in that area. Let's see. I think there is Medicare. I think there is a map where they show it. Let's see here, site map. So if that's what you're talking about, there is a jurisdiction map on the Medicare website. Let's see, AB MAC jurisdiction, June 2021. So this is the different breakdown of the Medicare contractor. So I'm over here in Novitas. Novitas also covers some areas over here, but mine is JL, theirs is JH. So this is the breakdown of where your Medicare contractors are located. So over here is Noridian. There's a lot of Noridian. My friends down here in Florida are in FCSO area. So that's all of the Medicare contractor areas. And if you haven't already, don't forget to hit that like button and that subscribe and the notification bell so you can get alerts when I post new episodes. Do I have any videos on certified tumor registrar? That's actually not an area where I have really a lot of knowledge at all. I mean, the most I have involvement with certified tumor registrars is I know there's some people that got into medical coding, found out wasn't really for them, and then wound up getting into the CTR. So I actually don't have any knowledge about tumor registrars. I'd like to learn more. If there's anyone out there who is a tumor registrar, I'd love to interview you and talk about if there's any similarities to medical coding and what that kind of information is. Haley says, please keep doing the CPC review videos. They are super helpful and I appreciate it. Yeah. Next, I still got to circle back. I still have to do that anesthesia one. And that's on my docket. I guess there's been a lot of questions. If you are not familiar with the community tab, there is a community tab on YouTube for my channel where I sometimes ask for feedback or post things to my community in general or just to my channel membership. And recently I reached out and said, I've got some ideas for upcoming videos, but what do you guys need? And there's been some curiosities, it seems, for the specialty credentials and talking about the specialty credentials. So that's upcoming within the next probably week or two, talking about the different specialty credentials, whether they're worthwhile and what those kind of processes look like. Haley. Yeah, thank you. I love doing them. I also want to do some more case studies, which is I think what I might do. I'm trying to figure out if I want to make 2 different forms or just one. But I think I want to make at least one form for, hey, if you have a question that I might need to look into a little bit and can't maybe answer live, submit that and then we can go over it. So like if you're like, hey, can I bill this and this together, or how does this get sequenced, that you can submit it via an online form, and that gives me some time to look at it ahead of time instead of having to research it live, which would not be very entertaining, right? So that would be great. And I'm kind of torn between do I want to make just one for the lives and then one for also coding scenarios that you want me to go over for reviews and stuff. Because my concern here is there's 2 things I don't want to happen. If I'm like, hey, send me some cases that we can go over together on the videos, or that maybe, is something that you're struggling with and I can discuss how to piece it together. So I have 2 concerns. Number one is that people are going to send me their homework and they're going to send me copyrighted material and I might not know it and then post it on my channel, and then I'll get in trouble for posting copyrighted material. My second concern is that people will take medical record numbers and forget to omit things like medical record numbers or names. And then I'm going to have to report it out as a HIPAA violation because people didn't scrub the private information off of it. So those are 2 things I definitely don't want to happen. So I'm a little bit weary about that. But definitely still open to people submitting information. I might just have to kind of set some criteria in how I regulate those forms. Rosebud is asking, what is the CPMA? So CPMA is Certified Professional Medical Auditor. It is a credential that's offered by the AAPC. So we have a whole lot of credentials that are offered by the AAPC, which is why it's probably a good idea that everyone said, hey, Victoria, maybe you should go off or talk about some of these specialty credentials. So the certifications that the AAPC has, let me flip myself over here so you can see it better. So these are the popular certifications: the CPC, which is the Certified Professional Coder, coding for services rendered by providers. COC coding for outpatient services, inpatient services, and then CPMA is certified professional medical auditor. So auditing for services that were rendered by providers. A lot of coders, after they've been in coding for a number of years, they migrate into more of an auditing role or a quality coverage type of role. So instead of just coding the charts, they're looking at charts that were maybe already coded, and we want to make sure that they're correct before going out to insurance or after they've been submitted to insurance. Or we're doing just checks on providers, like we pull 10 charts out of the past 3 months and audit them and see if we find any errors as far as levels of service, as far as maybe the coder didn't code the surgery right. Maybe there were diagnoses that were missed, and discuss those opportunities then with the appropriate parties. So that is the Certified Professional Medical Auditor. It is an amazing credential to have if you're looking to step up your career. I think the two most popular credentials that are out there right now for the AAPC are CPC and the CRC. A lot of people are getting both those credentials right now because then they can do pro-fee coding and they can do risk adjustment coding, which is just ICD-10 CM. Gina, I got my results on Thursday and I passed thanks to your videos. That really helped me. I failed by 4 points the first time and watched your videos for areas that I didn't do so well. Well, congratulations. That's exciting. Just got your results on Thursday. That sounds very, very, very exciting. I'm very happy for you. And I hope you have a great journey into medical coding and finding a career. Maybe you'll find something very soon. You know, there's a lot opening up these days. A lot. Mallory's asking, hey, Victoria, I had my first interview for a risk adjustment coding position on September 7th with HR. Okay. I still haven't heard back from the hiring manager for my second interview. Should I be worried? I wouldn't be too worried. I mean, let me look at the calendar right now. So September 7th. You had your interview September 7th. I wouldn't be too worried just yet. Sometimes, you know, some of these organizations are just super pokey. I've actually had situations where a manager got very upset because they wanted to hire me for a position and someone else in the organization hired me for another department first because they just take a while. You know, it could just be a lot of validations with human resources. Maybe they're just checking to see, you know, making sure that there isn't anyone internally that they have to offer it to first, that maybe they just want to make sure like everyone has kind of been extended it. So I wouldn't be too worried yet, but definitely keep an eye out. And if you haven't sent like a thank you card, that's always a great thing to do after an interview, is send a thank you card or a thank you email. Yeah, Uni's saying it took her weeks to hear back. Some of these places, they're just pokey. Just starting to study and see several things that I'm not sure I need: Evolve, Teach, TrueCoder, Encoder, Codify, etc. You know, it depends on what kind of program you're in, because there's a lot of different resources that they might offer to you through your program that you'll need at different steps during your journey into learning medical coding. So Codify is probably not something you're going to need right away. That's more a TrueCode encoder is also, so an encoder product is something that helps you either look up codes or helps guide you a little bit through the coding process, depending on what type of encoder it is. I've seen some that you can type in like incision, and they'll say, okay, incision, what was the incision into? Was it into the skin? Was it into the stomach? Was it into the joint? And that'll help kind of guide you to possibly what could be a correct code. Some of them, they help you look up code, or you can just look up the code definitions. So TrueCode encoder is an encoder program. Codify is also an encoder program. So depending on what kind of encoder you have and what you're doing right now, you might not need those encoders. Do I have any videos on coding peripheral intervention? I have a new doctor who does legs and I'm struggling with his charges. I don't specifically. Yeah, that's not one I think I have covered in any of my videos. I'm happy to cover more specific topics, but I think, like I said, I have to kind of piece together what I'm going to do as far as like if you have specific cases you kind of want me to look at, how to navigate that. And of course, I won't be able to look at every case that comes through, but there may be some that might be very, very helpful to look at. Let's see what we've got here. Ba, ba, ba. Yeah, Sheena's saying the background checks are super behind right now. So it could be anything that's causing some of those jobs to take a while for some of those responses to come through. Nicole asked, what are the steps that need to be taken to qualify and prepare to be a certified cardiology coder through the AAPC? I believe you have to be an experienced coder, but I don't know where to begin. So this is something I'm actually going to cover a little bit when I go over specialty certifications. So with the AAPC, there's no core, there's core credentials, but there's no sequence of how you have to get certifications. So if you want to go ahead and get a specialty certification because you only want to work in one specialty, you can technically do that. I have seen coders do that work just like you said in cardiology, and all they want to do is cardiology coding. So they just target cardiology coding and they just get certified as a cardiology coder. I had one coder that worked in internal medicine and she said, I don't want to take my whole CPC because I don't know everything about medical coding. I've only ever worked in internal medicine. And at the time they had a certification just in internal medicine and she just got that. So if we take a look though at the AAPC website, this is what we've got. So if we go to certifications and specialty certifications, let's see here, popular certifications, medical, view all certifications. That's what we want. So here are our specialty credentials that we have currently through the AAPC. We have surgical center, anesthesia, cardiology. We have ophthalmology, pediatrics, rheumatology, et cetera, et cetera, et cetera. So here is our cardiology, the CCC. So if you're looking to get this specifically, there's a lot of different resources that are available that you have to check out for the exam. So they have study guides for it. They have practice examinations as well. So here is, let's see here, prepare for the exam. So they do have a prep course, they have a study guide, they have a practice exam, and those are all resources that you can use if you just want to study for this. Now, of course, chances are good that if they're telling you, if this is a certification just for cardiology, they're going to probably structure it in a way where you have a base knowledge of medical coding. So that is what I would, that's what I would kind of go through the AAPC website, see what those resources are that they have available, and if you think those would be right for you for sitting for that exam. Amanda White is asking, can you touch on the difference in the COC and the ambulatory surgery credential is? That's a good question. I've actually not looked too much into the ambulatory surgery credential. I know the difference between the COC and the CPC, but let's take a look at them. We can take a look at them together. So ambulatory surgery examinees. So it says they have to read and dissect operative notes to apply correct ICD-10 CM, CPT level 2, and modifier coding assignment, types of surgeries that are allowed to be performed in an ASC, coding of ancillary procedures that can be assigned in addition to surgical procedures, as well as drugs and biologicals. So I think that might be different. There's probably more drugs than biologicals. Rules for reimbursement at ASC, which is also included in the COC. But it says here multiple device intensive and or discontinued procedures, regulatory rules established under federal and or state committees, med-term anatomy and physiology. So let's see if they have an exam breakdown here. They do not. I'm not seeing one here anyway. Let's see, approved resources, non-approved manuals. Yeah. I'm not 100% positive then what the difference is. Probably more so the drugs and biologicals. And possibly, I know the COC, they will test you on the inpatient coding, so DRGs and the IPPS. So maybe that's not in this one. Maybe they don't test you about the difference between the ambulatory surgical center billing versus inpatient coding. That would be my guess. So I have a question here. I just finished CPT Block 2, including HIPAA. There are so many modifiers in HIPAA in addition to level 1 modifiers. Any insight into how to organize them in my mind without memorizing them all? Concerned that I will be searching too long when taking the CPC exam. Thoughts. So here's my thoughts on that. Yeah, I mean, you're right about memorizing them all. You definitely do not have to memorize all of the different modifiers that are in HIPAA. Get familiar with them. That's my suggestion. Get familiar with them, because you have to remember, when you're sitting for the CPC exam, it is 100% multiple choice. So if you're looking at the answers and they have a HIPAA modifier on them, then you only need to look up that specific modifier in the HIPAA book. You don't need to be, you're not coding it without any guidance, for example. So if you're specifically talking about the CPC exam, you're going to be narrowing it down based off of what are the options in those multiple choice 1, 2, 3, and 4. So you won't have to piece together, from zero what that modifier is. So you can look that up in your HIPAA book when you come across that modifier. In a lot of the options, so let's say we have, question has options 1, 2, 3, and 4. Question the possibility. The first possibility might have modifier, E1, and then the next one has E2, and then maybe one has a 25 modifier and one doesn't have a 25 modifier. So there's not a lot that you're going to have to disseminate from, because there's probably going to be, as far as modifiers concerned, only 1 or 2 things you're going to have to look up. Like maybe one selection doesn't have a modifier and one doesn't, or maybe one has one type of modifier and the other doesn't have another type of modifier. So maybe one has RT, the other has LT, because one's saying right side, one's saying left side. How important is it to know insurance and billing information for the CPC? For example, knowledge about max coverages, compliance programs. There's not going to be a large volume of that. They might have a couple of questions about what a national coverage determination is. They might have a question about HIPAA, but that's not a huge portion of the exam. Actually, we can look at the exam breakdown on the AAPC website. So CPC, there's only a small section of questions on things like compliance, med-term, and then, so here we go. Compliance and regulatory is 5 questions. 5 questions out of the 150 on the exam are going to pertain to compliance and regulations. And it's mostly going to pertain to Medicare Parts A, B, C, and D. So they might ask you something like, say, you're billing for a prescription drug service. Is that going to be Medicare Part A, B, C, or D? Okay. Applying codes to payment policy, place of service reporting. So maybe they'll ask you a question about, if a provider is seen in their PCP office, what is the place of service that's going to be billed? Or a patient seen in the emergency department, what place of service is billed? A couple questions about fraud and abuse, a couple questions possibly about NCCI edits or the national coverage determinations versus the local coverage determinations, HIPAA, advanced beneficiary notices, and relative value units. And a lot of this I cover in my videos. So I have a video about RVUs. I have one about NCCI edits. Actually, these might not be bad topics for me to cover in some future videos, like the difference between the national and local coverage determinations. Some HIPAA stuff I can cover. ABNs I can cover, but I think Medicare probably covers it during their training better than I do. Lindsay West, I know attending school takes 1 year off your AAPC, your A for your CPCA. Can you do Practicode after you graduate to get rid of the A? Or can you not do a year of school off and do school plus Practicode? So let me go over the requirements with you. So AAPC, remove your A is what I type into Google. Apprenticeship removal and on the staff. So this is the website on the AAPC page where they lay it all out. Say goodbye to your A. So basically, to remove that apprentice designation, you have to have 2 years of experience or the equivalent. So 2 things that will take a year off of that requirement. You can do your Practicode. Completion of the Practicode successfully will take 1 year off of that 2-year requirement. If you go to a school and you get 80 contact hours of education and you can prove that with documentation, that will also take a year off. So if you do Practicode and school, that will fulfill the 2-year requirement. You could also do Practicode and a year of experience, or a year of school and a year of experience, anything to obtain that 2 years experience or equivalency. Now, as far as the school goes, there is some criteria as far as what has to be submitted. So it says you have to submit proof showing completion of at least 80 contact hours of a coding preparation course and one letter on letterhead signed from your employer verifying on the job experience. So the proof of education in the form of a letter has, coding prep course. The proof of education in the form of a letter from an instructor on school letterhead has to be on school letterhead, stating that you completed 80 or more contact hours, or a certificate or diploma stating at least 80 contact hours, or an unofficial school transcript. So that's what have to be submitted. You don't have to do that right away. You can wait and submit that. You can take a year off if you want, and then to concentrate on Practicode and finding a job. But once you have those criteria met, you submit them to the AAPC, and they'll send you an email saying, yeah, you've successfully removed your apprentice status. And then actually what happens after that is when you're an apprentice, they send you a certificate with your name on it, certified professional coder apprentice. And then once you have your apprentice removed, they'll send you a brand new certificate without that apprentice on it. It sometimes takes a little while to get the new certificate that doesn't have the apprentice name on it, but they will ship that out to you automatically. If you're interested in learning more about RVUs, I actually did a whole video that talks about RVUs, but RVU is a relative value unit, and it's essentially, it gauges how providers get paid. So for example, a heart surgery is going to have a very high RVU. Something like a mole removal is going to have a low RVU. And there's a reimbursement rate that's tied to that. So they take that RVU, they times it by your geographic area rate, and then they times it by a conversion factor. And then that's how they figure out how much you're going to get paid for that service. So the higher the RVU, the higher reimbursement. And then a lot of organizations will pay their providers based off of their RVUs, because then if they're seeing a lot of patients or they're doing a lot of surgery, they're bringing in more money, and then they, the provider, are going to get more money. There are some free RVU calculators out there through the AAPC. Calculator. Let's see, here we go. So let's say we're billing a 14301, 26010, a 69210, and we're billing units here. We can calculate them. They do have calculators in here, so you can see kind of the difference. The ones that have, and this is work RVUs, the ones that are more complicated have a higher work RVU. So a heart surgery is going to have a lot more RVUs than something that's more simple, like a small incision and drainage of a perinekia. But that was a great question. So just throwing this out there for those of you that have not started your medical coding journey yet, you're just still trying to learn more about medical coding, it is not too late yet to enroll in classes. I know a lot of people think, oh, well, the fall semesters have already started, but a lot of medical coding schools, I mean, even the community college business program that I went through enrolls every 6 weeks. So don't think that, oh, I've kind of lost my chance, I can't enroll because fall semester already started. You can definitely check your local schools. AAPC has live classes that they start every couple of weeks. There's on-demand courses if you want to do something on demand. I also have an agreement with onlinedegree.com. So if you're interested in finding a program that is something that I would recommend, I partnered with onlinedegree.com, and they developed this quiz that's the same kind of questions I ask my viewers. So like, where are you located? How soon do you want to be done? How much money do you have to put into a program? And they will offer special deals and discounts specifically for my viewers if you go to go.onlinedegree.com/contempo. So if you're still trying to figure out what medical coding school is right for you, definitely check them out, and they will point you in the right direction. Let's see what other questions I have got on here. Let me pull one of my questions that came in from Instagram. Let's see. Oh, I lost it on my drive. Here we go. Stream. Live stream. So I did get a question that comes in here. Oh, I've gotten a couple of questions recently about other certifying organizations. And I know there are some credentials that I kind of said, like, I don't think they're in demand by employers. There may be pockets, though, it seems like in the nation where certain credentials that in my area, they're not prominent at all. In some of my friends' areas, they're not prominent at all. But there are some certain pockets of the country, I think, where they will take other coding credentials. Your best bet, though, really is to get a coding credential either through AAPC or AHIMA, because those are the Coke and Pepsi of the medical coding industry. You can never, ever go wrong with having a credential through AAPC or AHIMA. Those are the big ones that employers really, really are looking for, AAPC or AHIMA credentials. But there are other organizations out there. I always get a little bit leery because I know there are some that may hold water in a certain state, but then there's other organizations out there that develop these. How do I say this without without it? Because I don't want to use certain words because there's certain people that have those words in their company, and I don't want to make it sound like I'm blasting that company. But there are certain educational institutions out there that develop these programs where they're like, oh, we're going to certify you as a medical coder under our company name, but they're really not something employers are looking for. I think they're just, some of them kind of looking to hopefully gain steam, but I don't think they are. So AAPC and AHIMA, you can never go wrong. All right. So a question. Oh, hey, SpongeBob. Good to see you in here. Question. I attended school and finished my program at community college, but the AAPC said they didn't renew my membership with the AAPC. So I wonder if I can take a year off my CPCA if I pass my exam. They didn't renew your membership. So SpongeBob, remind me, did you pass your CPC yet, or you still haven't taken your CPC? If I remember correctly, maybe you haven't taken your CPC yet. So I wonder if I can take a year off my CPC. Oh, if I pass my exam. Yeah. So you should be able to, as long as you can get that notification, that documentation from your school on the letterhead that says you had 80 contact hours, or you can get that certificate of completion. You can send that to the AAPC for them to consider for removal of your apprenticeship status. But again, remember, you have to do 2 years or equivalent. So just the education, you would also need to do the practicode to get your A removed. Rachel's asking, can you do 2 jobs at a time? Yeah, there's actually a good amount of medical coders I know that work 2 jobs. So they work a full-time job and a part-time job because they want to maximize their earning potential, and they work remotely, so they're cutting down on their commute time, and they're very efficient. I know some people that will take maybe a full-time coding role and then take a part-time pay per chart, and then they make a ton of money on that pay per chart, because they're just super productive, super efficient, and they can crank out more charts in an hour. They can get more money that way. And then with that particular part-time job, they're not having to have their pay docked for benefits and for all those additional things that might decrease your net pay. So that way they can really maximize their potential there. Yeah, Lindsay West is saying, I looked at multiple colleges to find out where I could get my CPC, and it's crazy how many of them didn't even know what certifications their program offered. Yeah, so some of those schools, they are tough. And again, I have to be very careful about my words here, but I know there are certain organizations that tend to embed themselves in colleges and universities. And so, oh yeah, we have this coding credential and we'll offer your students half off and you can include it and you don't have to pay. And it kind of seems to me, and I don't know the inner workings of it, like their business is really working with the colleges and getting them to pay money and then go, oh, we're going to offer this to your students. But then the students sit for that certain certification, which is not AAPC or AHIMA. And then the employers don't really recognize it because they just want an AHIMA certification or an AAPC certification. What can I do with a diploma is if you get a diploma, it depends. So some are just targeted towards medical billing. Some of them are medical coding. Some of them are medical billing and coding. But it should prepare you for, in most cases, revenue cycle jobs. So working somewhere in the revenue cycle, doing accounts receivable, doing coding, doing billing, doing claim edits. So there's a lot of things within the revenue cycle within the healthcare system that you can work. You can also work with insurance companies. I have some coders that work with, as they're more advanced in their careers, work with lawyers. They do compliance. They have their own consulting firms. But with the diploma, it will prepare you mostly for billing or coding jobs within healthcare or the insurance companies. Yeah, Amanda White, definitely check the accreditation. The other thing to consider too is if you're going to get an AHIMA credential, there are certain AHIMA credentials, in fact, most AHIMA credentials, where the program has to be approved through AHIMA. So if you're looking to get your RHIT, your associate's degree program has to be approved through AHIMA, that it's an appropriate program to sit for that RHIT. I think if we let's go on the AHIMA website. So if we go on AHIMA's website, they will give you the information on what is required for their credentials. So if, let's say, you want to get the CCS, it tells you what the eligibility requirements are. So it says that you have to complete courses in the following topics, or have 2 years of coding experience, or hold the CCA credential plus have a year of coding experience. You have to hold a coding credential from another certifying organization plus a year applying experience, or hold the CCSP, the RHIT, or RHIA. So there are criteria. AHIMA is a lot more strict than AAPC. AHIMA does have eligibility requirements, like you have to do this in order to sit for the exam. AAPC will allow basically anyone to sit through the exam. Of course, if you don't have formal training in medical coding, you probably won't do so well. But they don't have eligibility requirements as far as you have to go to a certain school or complete a certain program in order to sit for those examinations. Ruba's asking, I want to know more about the Codify, if it is usually bought by individual coders or organizations that employ coders. So it depends. So there's different tiers of Codify. There's one that's a cheaper one where you can just kind of look up the code descriptions or look up modifiers. There's ones that I think is one step above that where you can look up, lay definitions of the codes. You can look up bundling edits. And then there's some that are even more advanced on that you can add on CPT Assist. You can add on Coding Clinic. And some coders, their employers do pay for it. Some coders, they are not covered by their employer. Excuse me one second. Some coders, their employer will pay for paper books and that's it, but they don't maybe like their paper books, so they'll buy Codify because they find it easier to use. Or that might even be the reverse. Maybe the employer gives them Codify and they want paper books. So I like my Codify. Oh, that's right. I don't have a Practicode video, but I don't have a Codify video, but I can show you a little bit about what my Codify looks like in case you're kind of curious about it. So I have one as part of my instructor licensing. I get a subscription to Codify. And I have, I think, the mid-tier program where I can look up things like coding edits, like lay terms. Let's see, code lookup with Codify. Here we go. So this is what Codify looks like. Oh, welcome to Codify. Start here. Okay. So you can look up a code here. And it will give you the CPT definition. It will give you applicable modifiers you can use on that code. It will give you there's a lot of modifiers. Fee schedules. It will give you some coverage determinations. It will give you Medicare fees, RVUs, global periods. It gives a lot of information right at your fingertips. Some of this you can get for free on the internet, but it's just going to be more time to search through all of it. And Codify really just simplifies everything. They put it like right at your fingertips. So here's the one that I like. I love this lay description. You can get books that just have the lay descriptions of the CPT codes, but I like having them here to just search. And it tells you kind of step by step what the provider does during this particular service, which is super, super helpful for, I think, procedural or surgery coding. Because when I'm kind of questioning, like, is this the right surgery code? I can look up the lay description and see, okay, it says the provider does this, 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 and this. And I look at my note and I go, oh, yeah, it says in the note that the provider did this, this, and this. And this is definitely then the right code. So there's a lot of great information with that. The other thing it does is it will give you your NCCI bundling edits. So if I scroll down here, I can check if I bill 14301 and 13131 and 11402. Is there a CCI edit between all of those? And it'll tell me here, like this one, there's no CCI. And here it's saying, okay, yep, there's a CCI edit. And you should probably look to see if this is something where you can add one of these modifiers. And here's those associated modifiers. So it makes things a lot easier. And again, some of this information you can get for free on CMS, on the CDC website, on different websites, but it just makes it so much easier to just have it like right there at the tip of your fingers. Yeah, some of the memberships are kind of expensive, and that's why I know this is not what you should do. I am not recommending that anyone does this, but I do know that there are employers that will purchase things like Codify and encoder programs. And again, not condoning this, they will share passwords amongst coders because of the cost, which you can get bulk pricing for a lot of these programs. Uzar, I am seeing your questions, but I'm not familiar with those particular services that you're asking. Yeah, I know, I think I have to find out what they did for 2022. So it used to be that one of my favorites for the ICD-10-CM manuals, Optum. I liked the Optum versions. But I think the AAPC made some changes for like the one thing that I really wanted changed, which is having the chapter specific guidelines at the front of each chapter. I think they changed that in 2022. I haven't ordered my 2022 book yet to see yet. But that's a great one. And the thing I love about the AAPC version of the ICD-10-CM book is they put some additional things in there that are really helpful for the AAPC exams. So they like to ask questions on the exams about like the blood flow of the heart. Well, there's a whole chart in the ICD-10-CM manual that shows you the blood flow of the heart. So I think it's great to have that kind of pertinent information for you. So it says highest specificity. I like that name. Hi, Victoria. I started a job 2 months ago and they promised to move me to coding. I took the test this week and passed. They don't want me to move till 60 days. Would you advise me to find another job? Sometimes because of things that just go on with HR, they need things to fall on a certain calendar day for payroll or for processing. So I wouldn't necessarily say absolutely find another job. You can certainly look around and keep your eyes peeled if something interests you. But I don't think that necessarily means that it's not going to happen. Certainly keep your options open, but I wouldn't quit right away on the job just because it's going to take another 60 days. So that would be my recommendation. I know I need to get my 2022 books and then kind of compare and contrast and see if they did make those updates for those couple of areas where I wanted them to do the updates for. I think that'll be awesome. Oh my God, it's 3:00 already, you guys. I had a great time here hanging out, answering questions. Thank you guys so much for coming into the chat for another week of question and answer. Look out to the community tab because I'm going to put together that form where you can submit questions ahead of time. So if you have something that's a little bit more involved, I might be able to look over that and have it ready for the live. So I will see you guys next week. And until then, just keep on coding on.